Hello, my name's Anneliese Dressel and I'm a nutritional therapist and owner of the Health Hub Health Shop in Ballincollig, Cork, Ireland. A quick disclaimer before I talk to you about natural remedies for common health issues. I'm passionate about natural medicine and I've used it myself to stay in good health for many years with great success. Also, I've seen how the natural approach has helped many of my customers and clients over the years with their own health issues. However, the natural approach and natural medicine is not always the right answer. If you are experiencing long-lasting or recurrent symptoms, it's best to consult with your GP or health practitioner. Also, it's important to check that natural remedies will not interfere with any medication that you're taking. Anything that I talk about in the following video is not intended as a diagnosis, a cure, or prescription and is for general information purposes only. Thank you. Overactive bladder affects up to 30 to 40% of men and women over the age of 50. The most common symptom is a frequent and a very sudden urge to urinate, and it can happen anytime during the day or night. And some people might even leak urine when they feel this urge. It's basically the feeling that you have to go to the bathroom way too often and way too urgently. With the healthy bladder, there's signals in your brain that let you know when your bladder is getting full or is full, but you can generally wait to go to the bathroom. With overactive bladder, you can't wait. The signals are telling your bladder to empty even when it isn't full, and it's very, very difficult to control it. Overactive bladder can also be caused when the muscles in the bladder wall are too active, which means that these bladder muscles, they contract to pass urine even before your bladder is full. So there's a few different risk factors for overactive bladder. Neurological disorders are anything that's caused damage that impacts the signals between your brain and your bladder. Hormonal changes are a big one, especially after menopause. Muscle weakness in the pelvis, and this is particularly for women, of course, after childbirth. Urinary tract infections and recurrent urinary tract infections, because this causes a lot of inflammation in the urinary tract. That can affect nerve signaling. And certain blood pressure medications can also cause overactive bladder. Some diseases that affect the brain or affect the spinal cord, like stroke or multiple sclerosis, these could also result in overactive bladder. The medical treatment is generally the use of prescription drugs, antimuscarinics, beta-3 androreceptor agonists. These kind of relax the bladder muscle and they increase the amount of urine that your bladder can hold and that it can empty. Bladder Botox actually can be very successful for some people. This is where the botulinum toxin is injected into the muscles of the bladder, and it helps the bladder muscles relax and stop contracting when the bladder is not full. There's a type of nerve stimulation with kind of a pacemaker, which sends electrical pulses to nerves that share the same path for the bladder. And then as a very last resort, some people will need surgery. So an alternative treatment, of course, if there has been any issues with urinary tract infections or cystitis, it's very important to clear that up, making sure that the bladder tissue is very healthy. But angelica leaf extract is a great natural remedy, and it was found in a clinical study to reduce bladder frequency within an average of about 8 weeks of taking the supplement. And we've actually seen great results with this with our customers in the Health Hub, but I will stress it does take time to notice the benefit. Most people probably start to see a benefit within about 6 weeks. I think if you've been taking it for 8 weeks and it doesn't work, it's not going to work for you. Dietary changes can also help. Avoiding caffeine is a big one because that stimulates the bladder. And some people might find that citrus fruits stimulate the bladder, so you could avoid those. Also, alcohol, tomato-based products and chocolate. Finally, I suppose exercises that strengthen the pelvic floor. There's lots of those online. I'm sure you'll find some to do on YouTube. For men, an overactive bladder can also be caused by enlargement of the prostate. So have a look at the prostate video for information on natural remedies to keep the prostate and the bladder healthy.